I'm Dr. Daniel Potter, Medical Director at HRC Fertility here in Orange County, California. I work in the Newport Beach office and the Fullerton office. I'm board certified in both obstetrics and gynecology and reproductive endocrinology and infertility. My path to becoming a fertility specialist is a relatively convoluted one. In medical school, I originally had planned on being an eye doctor, believe it or not. And when I did my rotation in ophthalmology, I really didn't care for it all that much. Obstetrics and gynecology, which is what my father specialized in, is something that I, in the beginning, had absolutely zero interest in. And that all changed when I took the rotation during medical school, and I found it just to be the most amazing, exciting, and happy field in medicine. So I went into this field originally to help women, pregnant women, and deliver babies. It was during my residency in obstetrics and gynecology, in my first year of residency, we had a 2-month stint in the infertility clinic. And it was during this time that I really had an epiphany. I actually had a patient who was almost exactly my age, who was coming to me to have a child. I was at USC, University of Southern California, and that's we cover the LA County medical facilities. So a lot of our patients are, people from Latin America, and so this patient was exactly my age, and she had been trying to get pregnant for about 5 years, and she didn't speak any English. My Spanish wasn't the greatest, but I was learning, and we just really connected, and I knew, from talking to her how important it was, from an emotional, psychological, social point of view for her to be a mother. And I really felt that. And I also knew that if I did not literally take her by the hand and walk her through this Byzantine process, that it would never happen for her. And so I, committed myself to making sure that this young woman had an opportunity to become a mother. And I walked her through the county system and made sure she got everything she needed, made sure she got the treatment she needed, and she ultimately became pregnant and successfully had a child. And I saw how it completely changed her life, and it was the most amazing experience I had ever had in medicine up to that point. And I knew at that point that my mission in medicine, my purpose, was to help people that would like to become parents become parents. I feel that my calling to infertility treatment was further, verified in my mind when once I finally did finish all of my training and I was actually out in the real world and I finally had a job, which when you're in medicine, you have your first real paying job. You're 32, you know what I'm saying? And so it's time to have a family. I discovered that my wife and I were going to require in vitro fertilization in order to have children. And so that was a big surprise to me. I had no idea that that was going to be the case going into infertility. And it was a real taxing experience, but it did, I feel, make me a better and more compassionate doctor, because I have been through a miscarriage, I've been through failure, I have been through success, and it's part of what has shaped me and equipped me to take care of the patients that I take care of, and to give them the best care possible. I have, a set of twins that I believe is like 19 that has had their picture taken with me every single year of their life, and it's seeing things like that, and it just really gives a lot of meaning to what life's work has been, to see the impact that it's had on other people. It's incredibly gratifying, and it inspires me. It inspires me to work hard. It inspires me to do the best possible job. The original in vitro fertilization procedures were done in the 70s. The first successful one, I believe, was 77, 78. But that's recent enough that at our conferences, particularly when I was training, I had the opportunity to have lunch with the person who did the very first successful IVF cycle. I have had a chance to meet the very first IVF baby as an adult, or as a young woman. And so the technology went from being something that no one spoke about, that there would be a tremendous amount of shame involved with saying, like, I did in vitro fertilization. So in the history of the world, men with very poor sperm testing had almost a 0% chance to become a biological father. And so intracytoplasmic sperm injection, or ICSI, completely changed that, and that was a total game changer. I'm Dr. Daniel Potter, Medical Director at HRC Fertility in Orange County. I look forward to the opportunity to help you achieve your dreams of parenthood, and I wish you the very best of luck, whether you pursue that dream here with me or with one of the other amazing doctors that we have here at HRC.